your accounts by your full names. And while all participants and guests gather, please review the information from the partners and sponsor of the conference.
Екстра свіжість. Якщо ви помічаєте кров під час чищення зубів, яку саме зубну пасту ви оберете? Для здоров'я ясен чи для зміцнення зубів? Тепер вам не потрібно обирати. Новинка комплексний захист від пародонтекс – це 8 спеціально розроблених Тарасу.
Ну, як проходить. Так, тебе сейчас походу не просто это не будет делать. А, все, отлично, да. Значит, это мы сворачиваем.
А может быть устройство выбрать, у которого звук в настройках.
Та я вже відновлювала, зараз ще раз попробую. Я мене чути?
Знайомтесь, Тарас. Тарас диво, коли все добре організовано. Для Тараса комфорт надважливий. Тому і в питаннях зручності зубних протезів він довіряє лише новому Corega Comfort. Наша перша формула з технологією Adapta Grip створена спеціально для комфорту ясен. Зрештою, кому ж не сподобається екстра комфорт? Обирайте новий Corega Comfort.
Нас стає все дедалі все більше. Ще раз доброго ранку всім, хто приєднався. Ще раз подякую, що приєдналися до роботи нашої секції суспільних наук та філології. Доки збираються всі учасники та гості, ми можемо переглянути інформацію від наших партнерів та спонсорів конференції. Ще раз. Ну що, раді вас вітати. 9:00. Доброго ранку, дорогі друзі та вельмишановні колеги. Щиро вітаємо вас з відкриттям першої міжнародної студентської наукової конференції Medical Students Conference in Poltava та секції суспільних наук та філології. Хочемо представити вам, перш за все, наше вельмишановне журі. Кандидат філософських наук, доцент Лисанець Юлія Володимирівна, Кандидат філософських наук, доцент Костенка Вікторія Геннадівна.
Вона на лікарняному і, напевно, якщо вона тут не приєдналася, то, напевно, не змогла приєднатися. Приїдьте, будь ласка, вона є?
Не змогла приєднатись, її не буде.
На лікарняному, так. І ми всі кандидати філологічних наук, будь ласка. Філологічних.
Угу. Добре. Кандидат філософських наук, доцент філологічних, я перепрошую. Знаменська Івана Владиславівна.
Уточні, да.
Та кандидат педагогічних наук, доцент Сліпченко Лариса Борисівна. Ну що, журі у нас майже у повному складі. Звертаємо увагу на регламент і оцінювання усних і стендових доповідей. Кожний учасник... Я перепрошую, є якісь проблеми? Кожен учасник має лише 7 хвилин на виступ та 3 хвилини на запитання журі та слухачів. На період виступу камера доповідача має бути ввімкнена. Якщо ви хочете поставити запитання по змісту представленої роботи, скористайтесь кнопкою «Підняти руку». Або якщо час на обговорення вичерпано, члени журі мають право написати своє запитання в загальному чаті з вказанням назви доповіді і імені доповідача, а останній зобов'язаний відповісти протягом роботи секції. Оцінювання відбувається наступним чином. Кожен член журі на свою пошту отримав посилання на форму для оцінювання доповідачів. Просимо вельмишановне журі ставити бали учасникам одразу після обговорення та не закривати вкладку з формою до її надсилання. Нагадуємо, що оцінка наукового керівника не зараховується студенту. Система автоматично вираховує середній бал без оцінки куратора, і це не вплине на місце учасника в загальному рейтингу. Для зручності просимо доповідача і вельмишановне журі назвати акаунти вашими повними іменами. Якщо ви маєте будь-які проблеми з користуванням платформою, зверніться, будь ласка, до технічної підтримки нашої команди. Технічну підтримку нашої команди виконує Владислав Кислий, а наразі Семеняк Таїсія. Хочемо запропонувати всіх, хто матиме змогу переходити о 12:30 на головну сцену. Там відбудуться всі майстер-класи, а о 16:00 нагородження переможців та офіційне закриття конференції. Просимо тримати руку на пульсі, а ваші мікрофони вимкнутими під час виступів наших доповідачів. Good morning, dear friends, colleges. We certainly congratulate you on the opening of the first International Medical Student Conference in Poltava and the sections of Philology to Social Sciences. Так, всі зібралися. Так. Let's revise the regulations and evaluation of oral and postural presence. Each participant has 7 minutes to present and 3 minutes to answer the questions from the jury and the audience. The speaker's camera must be on the time of the presentation. If you want to ask the question of the content of the presented work, use the raise hand button. Or in the time of discussion, our members of the jury have the right to write their questions in the general chat indications of the title of the work and the name of the speakers, and the last must answer during the sections. The evaluation is as follows. Each member of the jury has requested a link to the evaluation from the speakers. We ask the jury to give points to participants immediately after the discussions is over and not to close the tab with the form before standing in. We'd like to remind you that assessment, the scientific advisor is not credited the students. The system will automatically calculate the average score without the supervisor mark, and this is not will affect the participants' place in the overall ranking. For everyone conventions, we ask to the speakers and the jury name your accounts by your full names. If you have any problems using the platform, please contact the technical support of our room, Vladislav Kisley. We would like to invite everyone who is able to go at 20:30 to the main stage, where all the workshops will take place, and the closing ceremony at 16 o'clock. Please stay intermediate sciences and keep your microphones off during the presentations of other speakers.
We have one more jury because Nadia has connected. Do you see her? So we have one more jury now present. Because Nadia Kostenko is here. So
Так, ну що ж, тоді запрошуємо до доповіді нашого першого учасника. Це Ірина Охрименко з доповіддю Manifestation of Major Depressive Disorder in Second Year Students of the Dentistry Faculty of UMCA.
So, good morning, dear friends, colleagues, and our dearest members of the jury. I'm very glad to open this section on our first International Medical Student Conference in Poltava. So, manifestation of major depressive disorder in second-year students of dentistry faculty of Ukrainian medical students, Stomatological Academy. Major depressive disorder is a mental disorder characterized by at least 2 weeks of low mood. Low self-esteem, loss of interest in normal enjoyable activities, low energy, and pain without a clear cause are also the common symptoms. Some people have periods of major depressive disorder separated by years, while others have all above mentioned symptoms are almost always present. Major depressive disorder is more severe and lasts longer than sadness, which is a normal part of life. The urgency of major depressive disorder problem is due to a high prevalence and severity of consequences. As far as you may know, the exam period is one of the most important and emotional periods in a student's life. Thus, it's very interesting to explore the connection between major depressive disorder and the exams. Choosing the topic of my work, I set several tasks for myself to carry out a theoretical analysis of major depressive disorder problem and to empirically determine the peculiarity of its manifestation during the examination period. 2 methods has been used for the research: Beck's Depression Inventory Test and Zhang Self-Rating Depression Scale. Here you can see the example of Beck's Depression Inventory Test. It consists of 21 groups of statements. The students read each group carefully, then picked out one single statement in each group that best described how they felt for past 2 weeks, including the day of the test. And on this screen, you can see the example of Zhang Self-Rating Depression Scale. It is a short self-administered severe to quantify the depressed status of a student. There are 20 items on the scale that rate 4 common characteristics of major depressive disorder. They are pervasive affect, psychological equivalence, other disturbances, and psychomotor activities. The students read each statement and marked the column which best described how often they felt or behaved during the past 2 weeks, including the day of the test. You can see that according to Beck's Depression Inventory Test, 85% of second-year students of dentistry faculty do not have major depressive disorder, and only 15% have a mild form of major depressive disorder. According to Zhang Self-Rating Depression Scale, 90% of students do not have major depressive disorder, and only 10% have a mild form. According to the results of the study, it can be concluded that the majority of second-year students, dentistry students of Ukrainian Medical Stomatological Academy, do not have major depressive disorder during the examination period. However, the results of 2 tests were different, thus we can conclude that the students were not completely sure about their answers. Also, it turned out that there are students who are prone to a mild form of major depressive disorder. These students should monitor their condition and consult specialists if necessary. Thank you for your attention. I hope you enjoy my report, and I'm looking forward to answer your questions.
Дякуємо, Ірина Валеріївна, за доповідь. Будь ласка, члени журі, учасники, ваше запитання.
Irina, thank you very much for presentation. Do you hear us? Is the sound
Yes,
okay?
yes.
So, Irina, what are the authors, which are the authors have already studied this problem? What are the sources of research? What are the important figures in this area have you addressed during your research?
Yes, thank you for your question. Well, major depressive disorder is a big theme to discover, and there are a lot of scientists who discovered this before me, of course. But my theme was major depressive disorder in second-year students of dentistry medical stomatological academy. So it's very small part of scientific work. If you want to hear from me what other authors discover major depressive disorder, I can name Beck, whose depression inventory I use, also Zhang, whose self-rating depression scale I used, and that's all. Is it okay? Like
Yes,
this
thank
answer
you.
is
And
okay?
what is the scientific novelty of your research? How is your research novel? What new contribution have you added to this area?
Okay, thank you very much for your question. As far as I know, no one in Ukrainian Medical Stomatological Academy studied manifestation between major depressive disorder and exam period, because we all know that it's very emotional period for students, and it was interesting for me to discover, is there any connection between these two things? I mean, major depressive disorder and the exams. And I'm very glad to say that majority of students do not have major depressive disorder. And I think that that's my novelty that I've discovered, that at least on second year students of dentistry faculty, majority of students do not have major depressive disorder. That was my novelty.
And how can you explain this absence of major depression disorder in this category of students? How can it can be explained?
Thank you very much. Majority of students do not have major depressive disorder because major depressive disorder is not just sadness or low mood, it's illness. It's a big problem, and if we would have a lot of students who have major depressive disorder, it would be a really bad situation, because it's an illness, and people who have major depressive disorder, they're literally sick. And I'm really glad that our students do not have major depressive disorder, because if they would have, I think none of them would attend academy. They would just go to a doctor and try to, they would ask the specialist to treat them, because it's a big illness.
Okay, and why did you choose this particular illness, not other psychological disorder, but specifically this one? Why is it relevant today?
Yeah, thank you very much. I chose this one because I've already discovered major depressive disorder when I was at school, but I've discovered major depressive disorder in pupils of school. And it was interesting for me to know if there are any problems that students have, separated by the problems that pupils have. So just like I just was interested in it, so that's why I chose this topic, and that's why I chose this disease.
Я перепрошую, час на дискусію вичерпано. Якщо у вас залишились будь-які питання до учасниці, ви можете їх продовжити задавати у загальний чат. Але я вважаю, що Ірина Валеріївна дуже справилася зі своєю поставленою задачею. Наразі ми запрошуємо наступних учасників. Це Свирида Олександр та Ющенко Яна.
Оцениваем мы сейчас, правильно их?
Да, вы оцениваете сразу после выступления каждого участника, но не отправляете еще форму.
Как? То есть далее нажимать?
Далее нажимаем просто, да?
Да, просто далее.
Хорошо, спасибо.
Середа Олександр та Яна Ющенко з темою доповіді Lexicosemantic Features of English Dental Technology in Endodontics. Готова до виступу? Добре. Ольга Козаченко присутня?
Да,
Чи готові ви зараз виступити замість Олександра та Яни?
так.
Тоді ми запрошуємо Ольгу Козаченко до виступу з темою доповіді True and False Facts about Brilliant Green Solution.
Okay. Good morning, everyone. I am Kozachenko Oля, student of third year. Nice to meet you all, and let me introduce my report. Today's report is True and False Facts about Brilliant Green Solution. And let's start. Nowadays, medicine cannot exist without aseptics and antiseptics. After all, they're an essential part, especially in different field of medicine, and it is an important component of surgical operations. And it can be as a rule of safety and health standards of medical professionals. The present paper aims to analyze and to describe the true or false and facts about Brilliant Green Solution. We will investigate the large amount of sources of the English medical websites on the above named topic to describe the division of the according to their true and false facts. The antiseptics have one thing in common. They have a wide spectrum of activity and are aggressive against the viruses, bacteria, protozoa, and fungi. There are examples of these drugs like Lugol's solution, hydrogen peroxide, potassium permanganate, Parkinson, and well known to us iodine and Brilliant Green Solution. Actually, a Brilliant Green Solution is greenish golden lumps of powder which are soluble in water, chloroform, and in alcohol, resulting in intense green 1/10 to already to use antiseptic solution. It's false fact that Brilliant Green Solution was developed by Soviet scientists. The truth is that is in the middle of 19th century, young English chemist William Perkin tried to create a newest malaria medicine through various experiments with coal tar. Nevertheless, the real name of Brilliant Green Solution is Viridis nitensis. It was called a diamond by pharmacists from France as an analog to the word brilliant. Currently, the green solution is used in post-Soviet countries. Also, all over the world, the antiseptics is authorized. But there is an exception. In the country of the West, accepted the evidence-based medicine, and that is why they do not use Brilliant Green Solution due to a possible but not yet known cancerogenic properties and its molecular mechanism. Brilliant Green Solution had ever been studied in the United States since the 1930s. Joseph Narrator from Chicago showed that Brilliant Green is an excellent for prevention bacterial infections in minimal invasive surgery. And an interesting fact that the use of Brilliant Green Solution for skin injuries can be wonderful treatment, because in future it helps healing the wound without having a scar. Significantly, it is an interesting that Brilliant Green is used as dyes for textile and other materials. The industrial application of green solution includes dyeing wool, cotton, nylon, and paper. And this solution is also used by gardeners to disinfect plants before germination in order to grow a healthy plant in the future. And as a conclusion, summarizing everything we have told, we can say that some of well-known to us information can be true, and in other side it can be false. Brilliant green solution was developed by English, not Soviet scientists, and some people think that it is toxic, and in others think it's one of the best treatment ever. Thank you.
Дуже дякую. Переходимо до запитань.
I have a question. What methods of research did you use in your studies?
I used a lot of literature, especially websites and chemical encyclopedias to discover this drug, because I think it's one of the most interesting and phenomenal. It's a phenomenon of our medicine.
Literature and sources are the material of your research, but what about methods of your research?
Methods was little practice in hospital and homemade experiments.
You also mentioned that brilliant green is not used in the Western countries because evidence-based medicine is widespread there. Can you please explain to us the meaning of the concept of evidence-based medicine?
The evidence-based medicine is, I think, it's a field of medicine which should know the exact aim and molecular mechanism of drug, but they maybe don't know how the brilliant green solution can work, and that's why they don't use and don't. I don't.
Well, as a matter of fact, evidence-based medicine it relies on clinical trials and randomized clinical trials, and after them they collect statistical data, reliable statistical data, and in such a way some medication is approved. So just for you to know in the future that evidence-based medicine requires reliable clinical trials. Okay?
Mm-hmm.
Thank you very much for your presentation.
Шановні члени журі, я дуже прошу поки що не оцінювати дану студентку, так як у вас форма оцінювання представлена згідно порядку учасників, які представлені у програмці. Тобто ви бали запам'ятайте, будь ласка. А зараз буде виступати Свирида та Яна Ющенко. Потім ви у програмці оцінювання впишете бали для Свириди та Ющенко, відправите, потім бали для поточної учасниці Ольги Козаченко та відправите знову. Добре? Добре, Яна Ющенко та Олександр Свирида, ви готові доповідати?
Так.
Так.
Добре, тоді запрошуємо вас до вашої доповіді Lexicosemantic Features of English Dental Technology in Endodontics.
Good morning, dear ladies and gentlemen. Let us present to you our scientific work, Lexicosemantic Features of English Dental Terminology in Endodontics.
Endodontics is a cornerstone of dental science, and it is essential to comprehend its terminological framework and background in English. The aim of the present paper is to analyze the lexical and semantic features of dental terminology in English, with a particular focus on the domain of endodontics.
Our research embraced 70 lexical units from the English sublanguage of dentistry in the domain of endodontics. We studied the prevalence of each group of terms in the modern English using the PubMed database over the period of last 5 years. The material of the research was considered via the method of continuous sampling, structural and semantic analysis.
Theoretical merit and practical significance you can see on this slide.
distinguish three groups of terminological collocations in the English dental terminology. The first group is represented by terms of Latin and Greek origin. The second group includes terminological collocations represented by proper English lexical units. The third group is represented by hybrid terms containing the semi-assimilated English-Latin words. The fourth group embraces terms borrowed into English from other languages of the world.
The first group is represented by terms of Latin and Greek origin, either preserved in English in their initial form or having undergone slight linguistic transformation. This group includes terms which fall into the following subgroups. The examples of one-word terms, two-word terms, and three-word terms you can see on the slide. As one can observe, a half of term in group 1 denote pathological phenomena in endodontics. The other half denotes physiological concepts, diagnostic and treatment procedures, as well as some instruments.
Example of group 1, phoenix abscess is an acute exacerbation of a chronic periapical lesion. It is a dental abscess that can occur immediately following the root canal treatment. It is metaphorically named after a mythical bird from Greek and Roman legends, associated with fire and the sun due to the acute nature of this condition.
Group 2 includes the following terms: file, rubber dam, etc. As one can observe, all terms in Group 2 denote endodontic tools. The ER suffix is the most productive term element in endodontics, forming the majority of names for dental instruments in this specialty.
Here you can see the examples of Group 2. Group 3, this includes the following terms: root resection, root canal treatment, pulp caping. As one can observe, most terms in Group 3 denote endodontic instrument. A few terms denote pathological conditions.
Group 4 are terms borrowed into English from other languages of the world. For example, tsunami irrigation, cofferdam, gutta-percha. The first two terms are dental metaphors, and the third one is a metonymy.
Tsunami irrigation means hydrodynamic disinfection. In the endodontic world, the metaphor is that vibratory energy within a well-shaped and full-filled canal serve to induce intracanal waves. Thus, this term is a metaphor, that is, an association created between concepts on the basis of their similarity.
Cofferdam is a shipbuilding term. Thus, this term is metaphor, that is, an associated created between concepts on the basis of their similarity.
Gutta-percha is a tree from Malaysia. The word gutta-percha comes from the plant's name in Malay. Gattah translates as latex. The name also refers to latex produced from the sap of this tree. Thus, this term is a metonymy, that is, an association created between concepts on the basis of their affinity. In endodontics, gutta-percha points are used to fill canals, following shaping and cleaning during root canal treatments.
Dental sublanguage of endodontics is largely based in Latin and Latinized Greek terms. However, proper English lexical units also occupy a significant place in this specialty.
One-word English terms in the domain of endodontics are composed of such Latin and Latinized Greek terms as itis, tomy, ectomy, hyper, hypo, and others.
Latin is a productive means of term formation to denote pathological conditions, physiological concepts, diagnostic and treatment procedures, as well as some instruments in endodontics. These terms constitute Group 1 and form the bulk of all terms in endodontics.
Group 2 and Group 3 denote primary endodontic instruments.
The ER suffix is the most productive term element in endodontics, forming the majority of names for dental tools in this specialty.
There are several metaphorical terms, such as phoenix abscess and tsunami irrigation, as well as a metonymy, gutta-percha, which constitute Group 4.
Let us draw the conclusion. Thus, the study of lexical and semantic features in the terminology of endodontics enabled us to reveal the internal linguistic laws of term formation in the contemporary English as a lingua franca in global research is international cooperation.
The level of mastering specialized terminology directly reflects the dentist's professional competence and comprehensive outlook.
Future research is needed to investigate the terminological framework of English professional vocabulary in other domains of modern dentistry.
Thank you for your attention. If you have any questions, we'll happily answer them.
Okay, thank you very much for your presentation. Hi. Your presentation was very meaningful, purposeful, and fulfilling, but definitely I have a few questions. The first one, why did you choose this topic of research, and what research methods did you use? So you may ask both, or you may divide.
Okay, thank you for your question. So we choose this topic, and I wonder because endodontics is kind of a young topic in the dental world. Yes, and we use Merriam-Webster and Oxford etymological dictionaries to make our work.
Okay, then what research methods?
Sorry, can you say again? Because
what research methods did you use?
okay, so a research method, we used the sampling, structural, and semantic analysis.
Semantic analysis. Okay, thank you very much.
Thank you. Thanks a lot. Thank you very much.
Thank you.
Thank you.
Можна питання до організатора, будь ласка? Just can I ask a question? Please, Анна. Як керівник я ставлю своїм студентам одинички, так? Символічно,
Так.
щоб... Окей, thank you. Тому зараз...
Наразі прошуємо в ваших картках журі оцінити Олександра та Яну, потім виставити оцінки до попередньої учасниці, до Ольги, і переходимо до наступного учасника. Добре? Запрошуємо до доповіді наступну нашу учасницю. Це Ілона Карлинська з дуже цікавою темою доповіді «The Phenomenon of Medical Epiphany as Directed in Health and Disease, The Good Doctor and Scrubs». Вас не чутно, Ілона.
Здравствуйте. Так.
Доброго дня.
Видно? Okay, I really appreciate being here. And today I wanted to represent my research work, The Phenomenon of Medical Epiphany, as depicted in House MD, The Good Doctor, and Scrubs. Okay, we as a medical student, we have really lots of opportunities for self-development. We have huge amount of resources for our medical education. We can improve our practice skills. We can deepen our knowledge in every valuable area. But sometimes that's really not enough for being a doctor. And the question is why? Okay, let's think. I suppose everyone knows this, like very smart students that have really deep medical knowledge, but in practice, he just can't put all his knowledge together and can't use it. So I think it's something about clinical thinking. And if we can just train our practical skills, can we train our clinical thinking? Can we just learn how to find this medical insight, as we say, medical epiphany? And the answer is yes. So the aim of our research is to identify, analyze, and classify medical insight based on their main features as they are presented in most popular dramas. So what we have done, we have selected 3 most popular medical dramas that you know. It's A Good Doctor, House MD, and Scrubs, which represented the moments of medical epiphany most vividly. And then we found all elements and triggers I will tell lately, and studied them. So epiphany as a moment of a sudden and great realization. They don't occur from nowhere. We need a trigger to find an epiphany. And upon analyzing relevant medical dramas episode, we just found these triggers and put them in the table. So the first one is conversation. When a girl called her teddy bear a dog, suddenly down in a house that his patient doesn't have a dwarfism. You see, like dog, dwarfism. People's behavior. When Wilson told House that his brother losing his temper, House realizes the patient condition has caused by immune overreaction. And here it's once more losing temper and immune overreaction. Physical objects and personal belongings. When Dr. Sean, in Good Doctor, realized that the patient had parasites after finding a chopsticks. Then visual stimuli. When a house saw a red color, he remembered a red staining Congo red and understood that the patient had amyloidosis. Contradictory facts given by a patient. House realized the cause of hormonal imbalance in two children after their father reveals a fact that he couldn't know. Mass media. In a Scrubs, Turk saves his patient from a paralysis after watching a TV show. Other patient cases. A male patient with a sympathetic pregnancy makes House realize that another patient have testicular cancer. Coincidence. When House just grabbed his patient's hands to discover his finger clubbing. Hypnosis and dreams. When House remembers how Amber was in a car accident. So based on these mental forces at work, medical insights can be conscious, as for example, after reading medical books or journal, it's mainly in a Good Doctor, and unconscious after non-medical related triggers, as it's shown in House MD. So the conclusion of our work. We identify, analyze, and group medical insight based on their main feature as they are presented in the medical dramas. We hope really that it's providing a better understanding of this phenomenon of medical epiphany and inspiring doctors to tap into their own creative potential.
Этот же доклад на английском первый. Ну да. А, уже thank you.
Хотелка устала посмотреть. Thank you for attention. Спасибо за внимание. Да. Классно.
А может кто-то выключить звук, пожалуйста?
Дякую учасниці за доповідь. Чи є запитання до учасниці?
Yes, please, Ilona, thank you very much for your presentation. And what is the practical significance of your research?
Okay, now, like I'm as a fourth year student, I had a problem because I really see that some students that just can't find an answer but they have it in his head. So that's why Ань, а можно выключить звук?
Perhaps somebody is interfering here.
Yes,
so
please.
there is a
Whoever
problem
it is.
with you.
Будь ласка, звук вимкніть. Okay, continue, Ilona, please continue.
Okay. Thank you. So that's why was my feature, like I just trying to find a way how to make it easier for student to find this medical insight. Like, you know, it's easier to find an answer when you know where to look.
Okay, so, but according to your descriptions of the material of your research, in each drama which you have analyzed, the doctor found the clue, the right way of treatment without knowing where to look for. Don't you agree?
Once more,
I just explain that. So usually epiphany comes when a person doesn't know where to search for it. This is why epiphany is from God.
Yeah. Okay, I understood. But you know, sometimes students just don't look on surround scenes. So it's like I think you can train this this clinical thinking. I think you can train how to find this medical insight because really students just like think and into their head and they don't look around. They just really sometimes don't want to look around to find their medical epiphany.
Okay, thank you. And how do you think, what is the objective, what is the aim of describing of such a phenomenon as epiphany in these dramas which you have analyzed? Why did the director, the author, choose this phenomenon to show to the audience?
I think maybe it makes dramas more interesting for people who don't understand medicine. They like, wow, he look around and understand what it means. Wow. And yeah, but for us it's better because we understand how to work with medical epiphanies.
Can you just briefly compare how is the epiphany different, for example, in House and in the Scraps, in a couple of words? What is the basic difference of this phenomenon in these
Yeah.
two dramas?
The first drama is a house MD, and he just found his epiphany in our surrounding scenes, like, I don't know, a piece of paper or skies or a table. And in A Good Doctor, he follows his epiphany after reading medical journals, after reading medical books, after conversations. Then, yeah, so.
Okay, thank you very much.
Thank you for the questions.
You're welcome.
Ань, вас не слышно, у вас звук
Не слышно.
выключен.
Я перепрошую. Так, я хотіла дуже дякую за зауваження. Хотіла запросити до доповіді наступного учасника Тимур Інгелічєв з темою доповіді Social Zones and Behavior Among the Transgenders. Who is blame? Тимур?
Yeah, thanks. Good morning. We'll be starting like in 30 seconds. Okay, so hope you're seeing this correct, right? Everything's all right. So I'll have brief premises first. It is my great honor, ladies and gentlemen, to finally be able to take a stand right here in front of you, explaining and defending my work. And I'm beyond grateful to each and everyone who participated in carrying this convention to its decisive fruition. Okay, so suicidal thoughts and behaviors among transgenders. Opening remark, transgender is but an umbrella term defining all the individuals that consider their sex to mismatch their real gender identity. As you may have known, the latest revision of International Classification of Diseases, ICD-11, will officially come into effect on January the 1st, 2022. One of the changes was a complete removal of F64 gender identity disorders group, now classifying its prior content under gender incongruence as gender incongruence under conditions related to sexual health. You may notice the lack of disorder keyword. This obviously being a part of the global effort in destigmatizing transgenderism leads to more people, specifically of younger age, attempting to rethink their identity and coming out as non-binary persons. The race group is growing bigger by the day, thus I find it relevant to conduct studies in the field. I consider these images to be somewhat relevant as well, them displaying at the very least the silhouette of transgender discussion in Ukraine. The aim was setting comprehensive analysis of statistical data available while looking for patterns and attempting to set the future research vector. And yes, this was mostly empirical research project based on the review of transgender demographic statistics and surveys on the title topic. Besides that, a concise screening-like survey was made and distributed among students. Okay, so the results are as following. Firstly, the suicide occurrences among transgenders are indeed more common than among cisgenders. For example, here is a set of adjusted precise data from the November 2019 paper. I chose it because I found its methodology and statistics calculation to be the deepest and most thorough. And up until now, I couldn't find any superior one. These are adjusted odds ratio with 95% confidence interval. The bigger, the commoner. But bear in mind, though, this publication features only adolescents. As for adults, October 2019 systematic review submits 46% suicide ideation rate and 27% suicide attempt rate. Well then, secondly, glance at the transgender demographics unveils interesting correlations. This is, at the moment, the best possible compilation of transgender population data in different countries, even though it features a lot of community estimates. The MTF population is usually quite bigger than FTM. Furthermore, the disparity between transgender density in different countries, and one can say cultures, is honestly humongous, like in here, for example. Next, thirdly, even after successful accomplishment of transition procedures, including invasive sex reassignment surgery, transgender individuals still are more suicidal than cisgender control group. Of course, this doesn't strictly mean that medical transitions ain't helpful. Truth be told, there is only one high-quality follow-up study to date. Take a look at this diagram of the data extracted from this study. You may also observe increased overall post-transitional mortality, not including just suicide attempts and deaths by suicide. Last but not least, the main indication for any transition therapy is aforementioned transsexualism or gender incongruence, and its analogs like gender dysphoria from DSM-5. In turn, these diagnoses require just a psychiatric evaluation and are based upon psychological criteria, which, with all due respect, are subjective. Despite there being a lot of objective intersex conditions like Turner or Klinefelter syndromes, which every medical freshman knows, CETA and biochemical analyses are neither conducted nor required. However, some prevalence of intersex conditions seem to correlate with approximate transgender demographic, that being like from 0.5% to approximate 1% of population. And as a postscriptum, I managed to have 65 students of Kyiv National University complete small screening like survey about their attitudes toward transgender people. The results are shown in this diagram using 1 to 5 index scale, bigger index, worse attitude. A certain confirmation of the world's general tendency of females being more tolerant is revealed, yes. Simultaneously, students of both sexes are more intolerant towards transgender women. Considering that lion's share of respondents were international relations progressive students, one may assume that the scores are skewed in the direction of tolerance. But for comparison, the mean scores among the American students were like 1.7, both towards transgender men and women. So time to draw up some conclusions. Among the transgenders, suicide ideations, attempts, and deaths are undeniably more frequent than in general population. This is commonly attributed to consequences of gender dysphoria and society transphobia. Rationally, these assumptions are correct. On the other hand, demographics irregularities, subjective diagnosis criteria, and current follow-up studies suggest the abundance of false positives. Consequently, more objective criteria, including lab analysis, should be included in newer protocols of establishing such diagnosis. Now, thanks for your attention. I eagerly await your questions, and I hope that after I've braced to my duties, you all will say this was his finest hour.
Thank you
Дякую
very
за
much.
доповідь. Запитання до Тимура.
Definitely this problem is very paramount. And I would like to listen to your explanation, to your attitude to this problem. So what is your personal attitude to this problem? Why this situation is so relevant, paramount? Why it is so outstanding or something like that? So, and what is your attitude to this problem?
Attitude is that right now that transgenderism is being over-normalized, if I say to say it that way. I mean, it surely ain't mental illness or something like that. But I've seen a lot of the young children, like 13, 14, 12 even years old, considering themselves being trans just because they felt like it for a second. And this tendency is what I don't like. However, we should always be able to differ, to be able to distinguish They are real people that come with this condition from the, I don't know how to say, imposters. Yes. So I've said about this that there should be more objective criteria. I sincerely hope we'll be able to help whoever will be in need, so that won't suffer any so that they won't suffer any dysphoria, and certainly won't attempt any suicides.
So do you think that identification will help people to prevent suicide problems?
No, I don't think so. To prevent the suicide problems, there should be less, like, I suppose there should be less transphobia on society, but we could now think about why the transphobia is generated. I think it may be generated from the overpresence of this thing of transgenderism in media. It's the common reaction, you know, in any world, in all of the world cultures, there was always a conservative group that were always being reactionary to any changes. And I can even understand them in one way.
Okay. Thank you.
Okay, Timur, and how can you explain why is this tendency observed in the modern world, this increasing tendency of transgender surgeries and this overnaturalization, as you have mentioned, of this concept? Why is it happening now?
I think it's just a byproduct of globalization, honestly. Of the internet, easier spread on information, people can easier spread their ideas, and so other people can easier catch them on.
So is this their psychological or like a psychological condition, the true medical condition which needs to be addressed, or just a fashion of today's world?
We need to distinguish. Yes, it was my point. There should be clear distinguishes between these things, the true medical conditions and button imposters. Imposters is not entirely correct word, and I'm sorry for using it. I just couldn't find any better in them at the moment. So in the demographic statistics that I've seen, the number of diagnoses has steadily increased, like in the past even 10 years has steadily increased. I don't think it's because of the, like, the genes couldn't have changed in 10 years, right?
Absolutely, yes. And in the medieval world, there was no such problem.
Yes.
Because there was
If
no
I-
such information and globalization.
If I can say one phrase in Russian, right? Бытие определяет сознание, как говорится. So,
Шановні учасники, час на дискусію вичерпано.
Okay, thank you very much.
Запрошую до продовження
thanks.
дискусії у загальному чаті. До нас вже готується наступна
Thanks, Anna,
учасниця. Ольга Майзос з темою доповіді Figurate Language in Titles of Medical Journal Publications.
Yes, hi to everyone, and now 1 minute, please. Do you see my presentation?
Yes.
So the theme of my presentation is called Figurative Language in Titles of Medical Journal Publications. So let's start. And the relevance of the study at present academic writing is greatly impacted by social shift and by mass media style. First, the impact consists in demonstrating less formal tone. Keeping serious tone means of world and academic writing was a key demand a decade ago that excludes in language. So you can see how it was then and how it is for nowadays. Titles are obligatory components of medical publications and can often be the only thing which one reads. Titles are important in literature, searching, therefore should be explicit and quite specific at the same time. And titles for communication potential. So the aim of my study is to identify the commonest type of figurative components and types of figures of speech and their frequency in the titles of medical journal publications. The corpus studied includes 180 titles of the publications from the issues of the New England Journal of Medicine by USA and the British Medical Journals by the United Kingdom for 2018. These journals are one of the most widely read medical journals in North America and the Great Britain because of its general non-specialist medical orientation. So you can see the England Journal of Medicine by USA and by the United Kingdom. Metaphorical language has long been considered of a fundamental part of poetical discourse and its interpretation linked to the linguistics analysis of literal genders. And like the lack of said in 1883, the locus of metaphor isn't in language at all, but in the way we conceptualize one mental domain in terms of another. Thus, the essence of metaphor lies in cross-domain transfer, understanding and understanding one kind of thing, event X, in terms of another Y. So you can see the normal sickle cell disease condition and when it in disease, and for the goblet cell. The study results are by the American Journal. It relies and demonstrated the tendency to use figurative language in the titles more eventually, while the British Journal sticks to the conventional formal style. So it's quite okay for the authors to be emotional in the opinion articles. Therefore, the titles of these articles converge with mass media or newspapers titles. So you can also see the diagram which demonstrates the distribution of the figures of speech by the genders. So using medical metaphors is a good way to explain science to novices or lay persons through palpebra of the visual things. The most of metonymy, oxymoron, and jargon examples appear in the titles as rhetorical devices, and you can also see in this slide infantile hematoma, which called also strawberry, which it by British magazine. And also about conclusion, I can say that metaphors are everywhere in popular culture and in science. And the main function of the using of metaphors in medicine is the nominal one, in which the aim is to explain the definition of medical terminology, and secondly, the framing when the aim is to make complex concepts, such as, for example, when the aim is to make complex concepts, such as, for example, mechanism of pathogenesis. And also metaphors foster clarity and transfer meaning effectively and economically. So thank you for your attention.
Дякую за доповідь. Будь ласка, ваше запитання.
Oля, thank you very much for your presentation. And can you explain to us what is the difference between metaphor and metonymy?
So thank you for such a good question. And metaphor is a thing regarded as represented or symbolic or something else. And metonymy is use of a linked term to stand in for an object or concept.
Thank you. And what is the relevance of your research?
Could you repeat your repeat
What
your
is
question,
the
please.
relevance of your research? The relevance.
Relevance. Mhm.
Okay, thank you. And what methods did you use?
Methods, two scientific journals, like I said before, the American magazine and United Kingdom
This is
magazine.
the material of your research. And what about methods? The journals are the material. What about methods?
Methods, the articles in such journals.
Okay, thank you very much.
Thank you too.
Є ще запитання до учасниці?
No, thanks.
Добре, тоді ми вітаємо наступного учасника Юрій Соляник з темою Acute and Chronic Urticaria Cases and Treatment.
Hello. Do you hear me?
Yes.
Yeah. Okay. Good morning, ladies and gentlemen. My name is Yuri Selanik, and today I would like to talk with you about acute and chronic urticaria. My aim for today's presentation is to provide you with the information about the disease, its causes, and treatment. At the beginning of my speech, I would like to introduce you to the order of report. First, I would like to talk about relevance and aim of my investigation. Then, we'll proceed with different types of urticaria depending on the cause of the disease. Following that, we would talk about urticarial treatment in different clinical cases. The relevance of my research lies in the fact that urticaria is one of the complex and controversial problems of modern practical medicine. Urticaria is a disease which is characterized by the appearance of a rash, blisters, swelling of the skin, which is often accompanied by severe itching. Almost half of the patients have hives that can swell with swelling of quincke, deep layers of skin, cutaneous tissues, and mucous upper respiratory tract, food tract, genitourinary tract, genitourinary organs. According to world statistics, it occurs at least once in a lifetime in 15–20% of the population. Urticaria is not contagious. The aim of this research is to analyze acute and chronic urticaria to identify the most effective treatment. The highest classifies with duration of symptoms. Acute, it is most common in children and adolescents. Young people, mainly with atopic symptoms, it continues less than 6 weeks. And chronic, the medical specialist believes that chronic urticaria is associated with autoimmune disorders. It continues more than 6 weeks. Also, it is classified on etiology, idiopathic hives and induced. Induced hives include physical urticaria, which divided into demographic, friction, mechanical action, blisters appears after 1–5 minutes, cold air, water and wind, slowed down due to pressure, skin pressure, blisters and swelling of deep layers of skin appear after 3–12 hours, usually painful. Vibration, for example, vibration of a pneumatic hammer, and heat, local heat effect. Sun, it's ultraviolet rays or visible light, and other. They are cholinergic, increase in body temperature, for example, after physical activity, or passive warming of the body. Round, small elements 2–4 millimeter appear after 2–20 minutes, not connected with anaphylaxis. Aquagenic hives from contact with water, context, latex products, for example, nuts, fish, clams, chemical, for example, formaldehyde in clothes, tar, animal saliva, ammonium persulfate in cosmetics, food products. It's the most common form of acute. There are the urticaria. Food urticaria. They divided into allergy, nuts and peanuts, fish, wheat, eggs, milk, soybeans, and various fruits. Non-allergic, caused by non-specific release of histamine, strawberries, cheese, spinach, eggs, plants, lobsters, tomatoes, high content of histamine or release of endogenous histamine. bacteria in fish of the mackerel family, for example, tuna and mackerel, which were producing histamine, provoking by food additives, for example, benzoates, sulfites, sodium glutamate, and medical hives. They are allergic, for example, penicillin and other beta-lactam antibiotics and local anesthetics, and non-allergic, for example, aspirin and other non-steroidal anti-inflammatory preparates, which cause an exacerbation of symptoms in 30% of cases of chronic idiopathic urticaria. X-ray contrast drugs, opioid, neurolaxants. After being bitten or stung by an insect, an infectionary disease, chronic autoimmune antibodies against immunoglobulin E, in serum disease, in autoimmune diseases, for example, Hashimoto's disease, systematic lupus erythematosus, and mixed connective tissues disease. Urticaria in malignant tumors, especially in lymphoproliferative neoplasm, in hyperparathyroidism. In rare genetic disease, for example, Markle-Wells syndrome. When treating urticaria, there are general guidelines for starting treatment. They are: avoid a provoking factor, for example, allergen and physical factor, if it has been identified. In case of food urticaria, apply an elimination diet. Avoid non-specific factors that increase or cause urticaria: drugs, alcohol, mental tension. Treat the underlying disease if the urticaria is secondary. The main treatment for urticaria is pharmacological treatment. Antihistamines are the basis for symptomatic treatment in most patients. Use H1 blockers that do not cause sleepiness. If the results are unsatisfactory, you may use a higher dose, up to 4 times the recommended dose. Other drugs. Consider the following for urticaria that is resistant to the above treatment. Cyclosporin, effective in the treatment of hives resistant to antihistamines due to side effects. Use only in severe recurrent cases of chronic urticaria. Monoclonal antibodies to immunoglobulin E, omalizumab. The drug is effective in a dose of 150 and 300 milligram per month. Yeah. Glucocorticosteroids used in the treatment of hives in serum disease, considered other chronic hives resistant to antihistamines. In conclusion, I want to say that this research is focused on the cases and treatment of urticaria. Also, several types of urticaria were considered. The most important part of the treatment of urticaria is the identification of the provoking factor and its subsequent elimination. It is also an important condition to see a doctor in time to prescribe pharmacological treatment to avoid complication caused by self-treatment. In most cases, the use of properly selected antihistamines is effective, although there are cases of recurrences. However, the combination of different methods of treatments leads to a positive result. Modern medical science has shown a huge progress in treatment this disease, but it is still a challenging one for both the patient and the physician. Thank you for your attention. I'm ready to answer your question.
Шановні члени журі, учасники, ваше запитання до Юрія.
Thank you very much, Yuri, for your presentation. And can you explain to us the etymology of the word urticaria? What does it mean from Latin? How is it translated from Latin?
Urticaria, it's a plant which causes blisters when it affects on our body.
Okay, so you just have described us the nettle, right? Krapiva. Okay, so nettle. Yes. Okay, thank you. And what is the English equivalent of this term? The proper English term?
Can you?
The English equivalent of this term. Have you met in literature maybe the equivalent English synonym of this word?
Urtica.
Hives.
Hives.
Yeah. So hives. What does the word hive mean in English? Have you met it though?
How to understand? Hives.
Oh, sorry. Yes.
Yeah. Hives. It's
So a hive is a place where bees produce honey. Yes, beekeepers keep bees fully, right? Hive means fully. Just for you to know for the future. Okay, thank you very much. And what other researchers have focused upon this problem apart from you? What other authors have did your research rely on?
I used the articles and books of Roy Patterson, Professor Boris Puklik, and Dr. Darina Koricka while doing my research.
Understood. Thank you very much. Thanks a lot.
Також для вас є запитання від Ольги Майзус. Воно написано в загальному чаті. Можете відповісти зараз, можете відповісти в загальний чат.
Yeah, I already said about materials that I used. It's materials from Roy Patterson and the professor of Winnicki National Medical University, Boris Puklik.
Чи є ще запитання до учасника?
Yes, I have. Thank you for a great presentation. And the question is, what is the relation between urticaria and allergy? Is urticaria a manifestation of allergy, or how to distinguish to these conditions?
Yes, urticaria can be provoked by it's an allergy reaction, but it's a lot of other things can make urticaria. Allergy is only one reason. One of them.
Okay, thank you.
Ми дуже дякуємо за доповідь. Є ще одне запитання, але час на дискусію вичерпано. Юрій, ви можете відповісти на нього у загальному чаті. А зараз я хочу подякувати нашим шановним членам журі та учасникам, всім присутнім за дуже яскраві роботи, за захоплюючу дискусію. Також хочу запросити всіх переходити на головну сцену на майстер-класи Study Smarter, Not Harder о 12:30 та European Code Against Cancer о 14:30. Та о 16:00 там відбудеться нагородження переможців та офіційне закриття конференції. Всі коди доступів ви можете знайти у програмці. We thank the members of the jury, participants, and everyone present for such bright works and exciting discussion. We invite everyone to move to main stage for the workshop Study Smarter, Not Harder at 12:30 and European Code Against Cancer at 2:30. And at 4:00 there we will be inviting to a ceremony of the official closing of the conference. You can find all accurate codes on the program. Та якщо у вас є зараз пару хвилинок та хтось має бажання бути присутнім на спільному фото, ми просимо залишитись на кілька хвилин у цій кімнаті та вімкнути камери. Ми зробимо пару скріншотів на пам'ять, якщо у когось є можливість. If anyone wants to be present on a picture, please stay for a few minutes in this room and turn on the camera. Всі підключаємось, посміхаємось. Заряна. Є? Хорошо. Дуже дякую всім за увагу. Запрошуємо всіх присутніх на головну сцену, на церемонію закриття. Дуже дякую. Вітаю всіх присутніх. До наступних зустрічей.